Hello everyone. Today's video is a little bit of a hodgepodge video. It's got elements of MCAS and anxiety and brain mapping and neurofeedback, and I'm just going to get into it. We'll see where it goes. So as per usual, nothing I'm saying should be construed as medical advice. If you need medical advice, please talk to your healthcare provider to get that advice. This is all for informational purposes only. And if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I would really appreciate it. So thanks in advance for taking a second to do that. So I posted a video about a year ago called MCAS versus microbial overgrowth versus hypersensitivity. And I assume in that video I was kind of contrasting those three different things. And so somebody posted a comment on a comment in there. And let's see here. It said, let's see here. Can there be partial symptom expression, i.e. anxiety without hives or itching? The action of the anxiety behind chronic infection / immune hypersensitivity is very interesting to me, and I'd love to hear more about it and cases with varying expressions of anxiety, particularly those where anxiety suddenly emerges, quote unquote, out of nowhere. Arguably, incredibly heightened anxiety always has a cause in some form. However, there are many paths that can lead there. So thank you for the question. And just for a little bit more context here, there again, it was kind of a comment on a comment. I had said in a previous comment, okay, the very first comment was, is it even possible to have chronic infection / chronic inflammatory response syndrome without mast cell overactivity? And I said, that's a good question. I'm sure there is always going to be elevated histamine with these cases, but many of them don't present with quote unquote classic MCAS symptoms like itchiness, hives, anxiety, diarrhea, etc. So anyways, probably should have just read the message thread from start to finish. So hopefully have not just left everyone feeling confused. So yeah, I wanted to comment on this because I'm just happy to answer questions in general on here, but then also just it is a really kind of interesting topic. So a person in my experience could definitely just have the anxiety piece of mast cell activation syndrome or histamine intolerance without the hives or itching. It's pretty uncommon to see that, but I have had patients where they're coming in with, say, anxiety on its own, or maybe there's, say an OCD component along with some anxiety, and they don't really have any physical symptoms per se. Maybe they're a little bit more reactive, like they're maybe more reactive to bug bites or something like that, but they don't have, hives and itching and rashes and things like that on the regular. It's just, it seems to be more of a sort of a mental health only related phenomenon that we're seeing there, or it's only impacting their mental health and form in terms of anxiety. So I've definitely seen that happen. In terms of the next part here, where it says the action of the anxiety behind chronic infection / immune hypersensitivity is very interesting to me, and you'd love to hear more about it. So, I mean, in terms of the kind of the mechanism behind that, I think, well, with immune hypersensitivity, my understanding is it's largely, if not entirely, histamine mediated. When there is immune system hypersensitivity, then we're going to see more histamine being released, and that can have an anxiety provoking effect. Now, I suppose maybe an exception there would be if there was some hypersensitivity issue happening and it was affecting brain tissue. So maybe if there was some cross reactivity with Borrelia or Bartonella or Mycoplasma or something that can affect the central nervous system, and then that was causing some anxiety potentially through different mechanisms, through some other type of immune system activation mechanism. So that would be a possibility. So if a patient, say, took some Borrelia LDI or some Bartonella isopathic or something to help regulate their immune system response to those microbes, like, oh, my anxiety is doing better, then that would be that's definitely a plausible thing, and I've seen that in other patients before. In terms of the chronic infection and kind of anxiety mechanism of action, I think that outside of it possibly being a microbial hypersensitivity, I think it's something that could also be just directly related to the microbe itself, so that we know that a lot of the well-known co-infections of Lyme, along with Borrelia itself, induce a lot of neuroinflammation, and in the face of that neuroinflammation, there could be dumps of not just histamine, but also, say, dopamine and norepinephrine and things like that, which would cause, glutamate as well, which would cause more nervous system activation and anxiety. So I believe that there could be like there are microbe-dependent mechanisms that, or mechanisms that are triggered by kind of the bodies of the microbes themselves, not just a cross-reactivity like I was describing earlier. So those are some of my thoughts around that. When I read this question, it also made me think about just something that I've been seeing time and time and time again. Now that I've been doing brain mapping in my clinic for the better part of a year, it's something that most of the patients that we're doing brain maps on are patients who are dealing with complex chronic illness. And so whether it's mold and or Lyme and or co-infections and or heavy metal issues and or dysautonomias and or all of the above. So one of the patterns that I'm seeing all the time in patients who are that we're doing the brain maps on is this more classic anxiety pattern. We're seeing lots of beta brainwaves, beta brainwaves being our most sort of high energy excitatory brainwaves, kind of akin to our sympathetic nervous system. So seeing that as a common manifestation of these brain maps. Also seeing a lot of what's called hyperconnectivity, where there's essentially excessive amounts of communication happening between different parts of the brain, almost like the brain's kind of like really busy and scattered. And then also seeing something called a abnormal beta asymmetry, where on a brain map we should see, relatively speaking, more beta brainwaves in the left hemisphere versus the right hemisphere. And in more of an anxiety picture, we're going to see the opposite of that. We're going to see more beta brainwaves in the right hemisphere versus the left hemisphere. So even in a patient where there's too much beta in general, at the very least we should see that there's a predominance of it, like we see more of it in the left versus the right hemisphere, and we see that being the opposite case in a lot of these patients. And so if we were to, say, take one of those brain maps and just pass it on to someone who just runs a general practice for, say, mental health support, and say, hey, look at this brain map, what do you think's going on with this patient? They'd be like, oh, these people are all dealing with anxiety, and yet it's my patient population, and some of them are dealing with anxiety, and goodness gracious, if you're dealing with all these complex chronic illnesses, like, it's anxiety provoking for sure. But I think that there's, I know that there's like something else going on there. We know that a lot of folks with complex chronic illnesses have nervous system regulation challenges because their bodies are going through so much, to say nothing of, the impact that it's having on their, day-to-day lives. And so it does kind of beg the question, it's a little bit of a chicken or egg, is it that the health issues that they're dealing with are creating this more anxious looking brain, or is it that the anxious brain that's been induced is maybe perpetuating some of these symptoms? Like, a lot of people out there, they're exposed to mold, get treated and remediated, symptoms go away. Some people have chronic symptoms despite ongoing treatment, or a lot of patients get exposed to an infectious microbe, they get treated, it goes away, they're good to go, but a lot of folks get these chronic pictures going on. And so this is part of what really sort of propelled me into the world of brain mapping and neurofeedback, because I have all these patients that, who do really, really well, and they get better, and sometimes not getting better as quickly as we'd all like them to, because it can sometimes take several months to get a person to the finish line. But then there's some patients where we've been at it for multiple years, and they're getting better, but it's maybe one step or two steps forward, one step backwards, and sometimes three steps backwards, and it can be really quite challenging with some cases. And so what I've been finding is that in these patients that would fit that description, these brain maps have been showing this type of pattern. And then for those patients who are able to then go on and do neurofeedback, not all of them, but for a significant number of them, we've been seeing some really great additional improvements, kind of getting them over the hump, so to speak, when we start working on the nervous system regulation. Lots of different tools out there for nervous system regulation. It's not just about neurofeedback, but I think it's just a really interesting finding that I'm seeing this pattern all the time in this patient population, and that it does seem to be something that's holding a lot of these folks back in terms of this more like revved up, kind of hyped up nervous system picture going on. So anyways, just this question kind of prompted, gave me the opportunity to talk about this topic as well, so hence the kind of mishmash of all these different things in this video. So anyways, thank you again for that question. If anybody has any questions or comments about this topic, this mishmash of topics, or anything else, please post it in the comment section below, and I'll do my best to answer as soon as I can.